COPD symptoms like coughing and shortness of breath can get in the way of your daily life. David Carden used to be very active outdoors until he was diagnosed with COPD.
I used to do a lot of activities, fly fishing for trout. I was a hunter. I played softball. But since the COPD, that all went by the wayside. I just don't have the breathing for it.
Symptoms of COPD include persistent cough that produces phlegm and shortness of breath, especially when you exercise or climb stairs. You may make a whistling sound called wheezing or feel tightness in your chest when you breathe. COPD also leaves you tired and drained of energy. And you may have signs of a cold, flu, or other infection. People with COPD often have triggers. The smell of varnish or a whiff of smoke can lead to a flare-up, setting off your coughing or shortness of breath. Keep a journal to track your symptoms when they happen and what you were doing at the time. Then you can learn to avoid your triggers. One big trigger for many people, including Sheila Zambetti, is strongly scented products.
In the supermarkets, it's the fragrances in the soap department, the soap powders, and they're suffocating.
Try to avoid these products if possible. If you do have to use them, do so in a well-ventilated area. Pollution and pollen in the air can also set off your symptoms. When they get bad, stay indoors with the windows closed and the air conditioning on. Most important, don't smoke or let anyone around you smoke.
Anyone who lives with a smoker, they should not be smoking in your house or in the car. And so encourage them to quit. And if they're struggling with that, let them do the smoking outside.
Not taking your medicine can also set off your symptoms. If medicine side effects are a problem, ask your doctor about changing your drug or dose, but don't stop taking it on your own. Infections like the flu, which affects the lungs and airways, can make coughing and shortness of breath worse. Avoid getting sick by washing your hands throughout the day with soap and water or using an alcohol-based hand sanitizer. Stay away from crowds and from anyone who looks sick. If you do get sick, see your doctor right away for treatment. Keep the humidity in your home at 40%. This will also discourage mold growth. If you have to go out on cold days, cover your nose and mouth with a scarf to prevent cold air from getting into your lungs. It's also important to be careful in hot weather when air pollution may be worse.
I feel like I need to stay inside on hot summer days. It's the humidity and the heat is, it really works on me.
Diet and exercise are important too. Drink lots of water and other fluids to flush mucus out of your lungs. Limit salt, which can cause your body to hold on to more fluid, make your feet and ankles swell, and worsen shortness of breath. Stay active. Exercising regularly will help your body use oxygen more effectively and improve your breathing so you won't have as many flare-ups. If you have a flare-up, call your doctor.
If you don't take care of a flare-up right away, it's going to get a lot worse, and so you may end up in the hospital. Worst comes to worst, you may end up in the ICU on a respirator.
Here are some other signs you need to call your doctor. Difficulty catching your breath. Trouble walking as far as you usually walk. Feeling more tired than usual. Having to use your medicines more often. Coughing more than normal and bringing up more mucus. A change in mucus color or texture. Fever, chills, weakness, or other signs of an infection. Confusion or forgetfulness. Other symptoms are serious enough to require calling 911 or going straight to the emergency room. These include breathing problems that are so severe you can't talk in full sentences and your medicine doesn't help. Chest pain. Blood in your mucus. Swelling in your legs, feet, or ankles that doesn't go away when you put up your feet. Or quick weight gain, putting on 2 pounds in a day or 5 pounds in a week. Since being diagnosed with COPD, Sheila Zambetti has learned how to deal with her symptoms.
Every day you learn something else to do that makes you feel better.
Learn more about managing your disease and living well with COPD, pulmonary rehabilitation.